पार्ट 2 में हम जानेंगे ऑटिज्म के डायग्नोस एंड उपचार के बारे में।
Getting an autism diagnosis can be difficult. There's no autism test, such as a laboratory test, to diagnose the condition. However, healthcare providers can perform specialized screenings and evaluations. The steps in the process of getting an autism diagnosis include the following. 1. Developmental surveillance. Your child's healthcare provider will look at your child's developmental history and behavior. They'll likely ask you to record your own observations to share with them at your child's appointments. This is an active, ongoing process where you watch your child grow and discuss your child's skills and abilities with their provider. 2. Developmental screening. Screening is a more formal step and takes a closer look at your child's development. Your child's provider may utilize a questionnaire to screen for autism. This includes questions and checklists to compare your child to other children of the same age. This test doesn't provide a diagnosis, but it can indicate if your child is on the typical developmental track or needs a more formal evaluation. 3. Formal evaluation. Formal evaluation takes a more in-depth look at your child's development. A trained specialist, such as a child psychologist or a developmental behavioral pediatrician, will observe your child and give them a structured autism spectrum test. They'll also ask you questions and have you fill out questionnaires. Can autism be cured? ASD is most often a lifelong condition that has no cure. However, your child's symptoms may get milder as they get older.
अब जानेंगे ऑटिज्म के उपचार के बारे में।
Autism treatment includes behavioral interventions or therapies. Every child with autism is unique. For this reason, your child will receive an individualized treatment plan to meet their specific needs. It's best to begin interventions as soon as possible so the benefits of therapy can continue throughout your child's life. Many people with ASD have additional medical conditions. These include gastrointestinal and feeding issues, seizures and sleep disturbances. Treatment can involve behavioral therapy, medications or both. Early intensive behavioral treatments involve your entire family and possibly a team of professionals. As your child ages and develops, they may receive a modified treatment plan to cater to their specific needs. The focus at that point is on employment opportunities and job skill training. The autism spectrum includes conditions that providers used to consider separate, including 1. Autism 2. Asperger syndrome 3. Pervasive developmental disorder, not otherwise specified, PDD-NOS. Asperger versus autism. Asperger is a mild form of autism. Autism versus ADHD. ADHD and autism are related genetically, as well as, having one of these conditions increases your child's risk of having the other. And a child with autism has a higher chance of having a close relative with ADHD.
धन्यवाद।